Hopkins researchers have analyzed medical death rate data over an 8-year period and found more than 250,000 deaths per year are due to medical error here in this country. The Centers for Disease Control now ranks as the third leading cause of death. So we brought in our medical expert, Dr. Kevin Campbell, to tell us more about this. What is medical error, doctor?
So, that's a really broad term. Medical errors can be anything from poor judgment by a healthcare provider, or it can be a medication error where someone's given the wrong dose or the wrong medication entirely. There's a lot of reasons that we see these errors, and these studies have really kind of brought this to light, that we need to do a little bit better job figuring out what's going on.
It sounds very scary, the third leading cause of death. So talk to us. Tell us what hospitals, what doctors are doing, what systems are in place to prevent medical error from happening.
You know, one of the things we have to remember is this study looked at 4 smaller studies. So we have to take the findings with a grain of salt. There's a lot of debate about how accurate the number of deaths are. However, what it tells us is that we need better systems. We need to be able to communicate among healthcare teams a little bit better. We need to make sure that we're able to hand off patients between emergency departments and units so that no lapses in care occur.
And it also comes down to the patient and the advocates and the people who, care and love that patient, being there for that patient, making sure that there's the right communication taking place. Is that right?
Absolutely. One of the most important things I think we can all learn from this story is the fact that if you advocate for yourself or your loved one when in the hospital, it can make a big difference. What I mean is when someone comes into your room and gives you a pill or wants to give you a drug, ask what that drug is. What's it for? What does it do? If they send you off for a test in the hospital, ask why you're having that test and how it may affect your care. If you do that for yourself or your loved one, I think it will be another check in place that makes sure that you get the right care that you need.
That's something all of us really need to keep in mind, because it can be intimidating. If you're in the hospital dealing with doctors and nurses, you may not know what to ask, or you may feel scared to ask, but you should.
Absolutely. You've really got to advocate for yourself. And, one thing you need to know is the healthcare system as a whole, we're putting in lots of checks and balances. There's lots of ways that, for instance, if you're going to have a surgical procedure, we do a timeout where all the work in the room stops and we talk to one another, verify your name, your medical record number, and what's going on. So there's lots of checks and balances there for you.
Communication is so key, especially when it comes to avoiding a medical error from happening. Dr. Campbell, always great to have you. Thank you so much for being here. If you want to reach out to the good doctor, it's easy to do. Go to our website at WNCN.com. You'll find all of his information there, including his social media accounts.
I'd love to see.
You hit on the third leading cause of death in the United States, and I'm sure most of us could figure it's either heart-related or cancer or diabetes, things like that. Can you clue us into what that is and why?
Yeah, okay, and thank you for asking that, because this is the 10,000-pound gorilla in the room that nobody's talking about. The third leading cause of death, as published in the Journal of the American Medical Association, is MD-directed treatments. This means you go to a medical doctor, an MD, he gives you a treatment and you die from it. According to the United States Department of Health and Human Services, 15,000 Medicare patients a month are killed by MD treatment, and nobody goes to jail. A handful of terrorists fly 2 planes into the Twin Towers. 3,500 people die, and we go to war. But 15,000 people a month are killed by medical doctor treatments, and we don't bat an eyelash. This is because we have been, I don't want to say brainwashed, that's not the correct term, but we have been, for the last 100 years, kind of led into this false belief. I think it was Marcus Welby that started it, that the medical doctor is king and knows everything about everything. And really, you need to just shut up and follow your medical doctor's advice. Most people in the United States have no idea at all of the history of the evolution of medicine in the United States. In the early 1900s, it was a relatively level playing field between the chiropractors, the osteopaths, the homeopaths, and the MDs. In 1915, 1920, there was something called the Flexner Report. The Carnegie Corporation funded this man named Abraham Flexner. He went all around the country, and he went on stagecoach and train and horseback. This was before the interstate highway system, right? Took Flexner 5 years to do this. He went all around the country and did an inventory of all of the medical schools that prescribed drugs. He brought the list back to the Carnegies, who own drug companies, and then the Carnegies and the Rockefellers gave millions of dollars of free money to the medical schools and hospitals in the United States that were prescribing drugs. That was the beginning of the end. After the Flexner Report, there was no more level playing field in the United States. And the MDs started a juggernaut that's taken off. Most people in the United States think that the predominant medicine here, MD-directed pharmaceutical medicine, we think that those guys are top dog because their therapeutics are better than the homeopaths or the naturopaths or the chiropractors. It's not. They're in the driver's seat because of political and financial coalitions that were built at the turn of the century that most people have no idea of at all. And it's a gigantic problem. And I mean, it's crazy, right? It's the third leading cause of death. And yet, when the government makes noise about messing with people's insurance, everybody freaks out. And that's a whole other thing to talk about, isn't it? Because what is medical insurance? When you buy medical insurance, what are you doing? You're betting that you're going to get so sick you will not be able to afford it. Right?
Yeah.
Right. And then, so you pay good money every month to gain access to a system of medicine that's the third leading cause of death in the United States. We need our heads examined, quite frankly. That's why we give, Dr. Wallach and myself collectively, we give 400 free lectures a year. And we're building a grassroots network because people don't know this. I mean, I come to my lectures and they look at me and say, couch potatoes live longer? Medical doctors are the third leading cause of death? You know, what's going on here? We're like the people, you know, in Galileo's time saying, hey, everybody, you know, it's the sun that's at the center of the solar system, not the earth. Well, hey, everybody, the earth is round, it's not flat. Or, hey, everybody, slavery's a bad thing. Right? This is we have a social agenda here. Why do we have a social agenda? Because people are suffering needlessly. You wouldn't believe, as God is my witness, you would not believe the things that I've seen people recover from in holistic medicine. The body's ability to fix itself is remarkable. And most of the time, all that the body needs to do that is the raw materials that it needs to do that. And we need to stop eating food that's hurting the body. You know, if you put diesel fuel in an unleaded engine, even if it's a brand new Ferrari, it's going to run like crap if it runs at all. And there's nothing wrong with the car, it just had the wrong fuel. It's the same with the human body. You give the human body the raw materials that it needs, clean up the diet, Superman, Superwoman. And you know, if you don't get to super status, then at least your blood pressure normalizes, at least your arthritis goes away, at least your anxiety and panic attacks go away, and you can sleep through the night.